Okay, so thank you so much for joining me today. It's great to see you. Can you tell me, please, a little bit about what you do and what your organization does?
Sure, absolutely. Probably best to start with what Avizia does. Avizia is a telemedicine, telehealth solution provider. We have both hardware, software, peripherals, and mobile apps that really we seek to power health systems and empower them to be able to deliver telemedicine and telehealth services to their own patients. So, really, we're the tools that help empower them to deliver care to their own patients.
Okay, and so is that the most critical component of what you do, or what telemedicine does is to deliver the care? Or I don't want to put words in your mouth. What do you think the most critical?
When you say most critical, what do you mean by that?
I think maybe there's so many important things, but what do you think is the most important, and or even the second most important? Like, because it's such an evolving industry. So I'm interested in the impact that you're making and the one you're most proud of.
Sure. Yeah, I think for Avizia, the most important thing is continuity of care. And so, really, what makes us different from some of the other people in the industry is that we empower these health systems and health providers to be able to care for their own patients so that they can provide care that is reflective of the care plan, reflective of their familiarity with their patient, so that they can provide care, whether it's in an emergency room setting, in an outpatient setting, or in their own home, in the convenience of their own home, can sort of leverage the technology to be able to sort of maintain that continuity of care with their own patients, rather than having some strange, unconnected doctor who's not familiar with that patient's, health status be the one delivering care to them.
Have you seen, or can you tell us an anecdote of a specific case where the technology really?
Um, it's interesting. The space is evolving, as you said, so quickly. So I think the thing that comes to mind for me right away is that really within the health system, we're making sure that the providers are using their own electronic medical record. So they have all of the information available about the patient, all the records, all the family medical history, social history, medication history. So all of that information is available to them. And then they're using our tools to be able to deliver care when it's needed, where the patient is and where the provider is. So just making that connection with patients. So, for instance, we have some health systems that are using our tools. They have reduced, in the emergency room, they have reduced the door to discharge time in the emergency room from 2 hours and 40 minutes down to less than 40 minutes.
That is a huge impact.
Absolutely.
Yeah, if you've ever been in an emergency room, you know that's a long 2 hours.
Yeah, so real high satisfier with respect to the patients. Really improves throughput in the emergency room and enables them to see more patients in a day because they're moving the patients through faster. They're getting good care, they're getting appropriate care, and just a real great overall satisfier. And another example in the emergency room is psychiatry and telepsychiatry. So we have seen, again, same customer, same partner, reduce the door to treatment time from up to 24 hours down to 2 hours. So just a monumental change. So you can get the patient diagnosed faster, get the patient treated faster, and get them back on the road to recovery and make those decisions that need to be made much faster.
Wow. So, what do you see the future of
What do I see the future? That is a great
the
question.
industry?
So I've been coming to the ATA for, I think this is my 9th year.
That was going to be my next question.
It's a long time. It's really been great to see the ATA grow and evolve and change and mature and really adapt to the industry and the market. Where I see it changing is I see health systems starting to really focus on the continuity of the experience for patients and continuity of experience for providers. So if you're a emergency medicine or general medicine provider, there's a number of different venues that you could deliver care in. You could deliver care in the emergency room, you could deliver care in the inpatient setting, you could deliver care in the outpatient or urgent care setting, or the home in a direct-to-consumer model. The challenge to date has been that there are solutions, all of the telemedicine solutions have been very siloed. And so they are a solution that targets a specific slice of the care continuum. And so what we see now is telemedicine providers starting to evolve, starting to develop platforms and solutions that span the entire continuum of care and can start to deliver, one experience for the providers so they don't have to have multiple user interfaces that they have to log into, and one experience for the patients as well.
Wow, that's fantastic. So you were saying this is your 9th year here?
It is.
What is it? What about this conference keeps you coming back?
That's a great question. I think first and foremost, it's the opportunity to network and connect with peers and colleagues. The telemedicine community is such a tight-knit community. The ATA is a wonderful forum for us to share ideas in a non-threatening way. And you regularly hear people talking about their successes and their failures. And so they share their failures so that we can all learn from them, and so that we can all learn not to make those same mistakes twice that they may have made. And it's a very safe environment to do that. So networking and being able to learn from others is first and foremost. And I think second, being here in the exhibit hall, just to see an opportunity to see in a focused 2 days all of the different technologies that are available and at our disposal. What's new, what's breaking technologies that we can leverage and take advantage of.
And what are you looking forward to the most over the next couple of days?
It's interesting for me. So I've changed roles. I used to run telemedicine programs for health systems, and now I'm on the technology partner side. And so for me, the next 2 days are meeting with as many people as I possibly can to learn about what their biggest challenges are, and to help them think about what possible solutions might exist for them, whether they're Avizia solutions or others. Just having the opportunity to speak with them and be able to learn from them and to share some of my own experiences.
Yeah, this is a great forum for that. I'm curious, have you seen a lot of changes in the conference over the past 9 years? It's grown.
Yeah, it's definitely grown. So the size and scale of it, it seems to get bigger every year. And John Linkus and Gary Capistrant and the ATA leadership team do a wonderful job, as do the entire board and organizing committee. How has it changed? I think that what's interesting is that I feel like we've finally moved beyond the phase where we're talking about just those same 3 barriers over and over again, and finally moving past that and talking about solutions and ways that we're moving forward to deliver care irrespective of what those barriers might be.
That's really fascinating. I'm so pleased that you dropped by to speak with us today. Thank you.
Oh, thank you. It's been a pleasure.